Of course, type 2, we're seeing now that we're talking about staggering numbers in young people and children.
Yeah, it's just alarming. A 95% increase. Dr. Hebert, the study was conducted in 2001 and 2017. Do you believe the pandemic may have made the problem worse?
Yes, without a doubt, the pandemic has made it worse. Now, let me just tell you, from being a pediatrician, taking care of kids in the ER as well, for the last 20 years. When I first started my internship at Tulane University, I didn't have any type 2 diabetic patients, right? Now, over 20 years of practice, I have about 60. Now, that's more than a 95% increase. And the reason why is because of obesity. The reason why is because of increased internet, increased video, increased people having these static lifestyles. But it also is the fact that children are eating horrible processed foods, and their obesity has gone through the roof. And once this happens, right, then you have no other way except your body to react and to have type 2 diabetes. And that's something that we see in adults, but we never saw these numbers in children. I literally, in the last 18 months, however, have seen it go so poorly, meaning that I had a young lady yesterday. She was 292 pounds, 13 years old. And one of the keys is that the parents, the mother was like, but we don't eat anything poor. We don't eat anything bad. Everything is great. And I'm like, no, it's not. We've done all the lab work on you, man. It's not. It has to be intake. And people just don't understand what's good and what's bad. They don't understand sugar is bread, rice, potatoes, and noodles. They just don't understand that. And that's what our diet consists of for children.
Yeah, wow, Dr. Hebert. Dr. Corder, according to this new study, it's Black and Hispanic children that are being impacted the most. How much of this problem is a product of culture and personal choice, which is piggybacking off of what Dr. Hebert just said, or is it about socioeconomic conditions like food deserts?
Absolutely. Well, exactly. Food deserts, we're seeing a lot of. It's cultural as well. And it's, with the pandemic, we have seen an increase in my practice as well. I've been in practice 35 years. I'm also an adolescent specialist. And with that, when I became a pediatrician years ago, we said, I'm going to become a pediatrician because we didn't see chronic conditions. Well, agreed. I see the same percentage now, a good 25 to 30% of diabetics in my practice. Social economics, processed food, and it's just for me, I'm talking to the parents and they're unaware of what we're talking about when we talk diabetes. They're thinking it's sugary things. And one thing I want to also mention, in my practice, I have been doing a test called hemoglobin A1C from 8 year olds and above, just because I know the high risk of my population, my Black and brown parents and families, and we see it. So obesity is definitely surging to 25% of my population here in Washington, D.C. And of course, it's difficult to find good food, non-processed food. Of course, there's a cost factor. The noodles and the processed potatoes and all of those things that they like, as well as, of course, the less activity. So it's about educating each family and letting them know when you say diabetes and you show them the lab work. Sometimes that gets their attention because down the road they know what diabetes is all about. And if we don't begin to become more aggressive as providers to let them know this is already here. And the longer that you're suffering from this condition, the not only the longer you have it, but also it's difficult to reverse. And then you begin to see the severe side effects that gives you organ failures as a diabetic.
Dr. Hebert, this is something we often hear in our community, big boned. Can you talk about how that is not a reason to be overweight?
Well, at this point, we have had a lot of pop culture misinformation. I mean, you can talk about the whole Lizzo phenomenon, and you can talk about the whole concept of the athleisure wear and all this stuff. And there's no disrespect to anyone who is overweight, because let me tell you something: trying to lose weight is very, very difficult. But I think that there is more of a latitude for people to think that, oh, well, I'm bigger, then that's actually okay, because you can have skinny people that are actually unhealthy, and you can have people that are bigger that are obviously healthier. But the problem is that when we start factoring in this whole concept of socioeconomic status and culture, African American women, our standard of beauty is very different than a white standard of beauty. But on Instagram and on Facebook, the standard of beauty, once again, has always been the skinny model. But now it has actually become, in our communities, it's become a little bit different. It's become the woman who is more voluptuous. I mean, you look at the Kim Kardashians, you look at all the rest of these people that have over 500 million followers on these social media platforms, and that's what people are trying to look at. But we can never divorce the whole concept of the social determinants of health, because we want people to eat well and to stop eating these quote unquote slave diets with all of the carbohydrates. But if you know that you can get a bag of potatoes for $3, but a bunch of broccoli at one of these holistic organic stores is going to be $10. I mean, you cannot divorce these things, because even if people want to really do well, they still sometimes cannot. And that's where we have to level these things out and level the playing field and make it so that we have the ability to get the foods that are appropriate and to eat the foods that are appropriate, and make sure that our parents are eating well too. I mean, I do lectures all over the world, and parents say, well, I eat M&Ms and drink soda, but I don't want my child to do that. Well, you can't do that. You have to do it as well.
Yeah, Dr. Corder, I want to ask you a question. Can you discuss, as a pediatrician, the long-term impacts of diabetes on the body, especially with these young people getting it so early?
Yes. You know, hypertension, high blood pressure, we talk about that being with one of the long-term effects. But I will tell you, the long-term effects of diabetes gives you strokes. We just saw a study about a year ago that when most folks say, well, high blood pressure causes more strokes than any condition, actually diabetes does. And when we're talking strokes, we're talking often fatality or major disabilities. Again, with the pancreas being limited, as well as the kidneys, you have problems. That's dialysis. That means you go into a center twice a week to allow your kidneys are not working, what we call renal failure, to allow your body to get rid of the toxins. Often we talk about amputations with a diabetic. That means losing a toe, losing a foot, losing a leg. So these are the things that we bring to conversation right away, because often they'll have a cousin or an uncle, but now we're seeing severe diabetic fatalities and conditions and much younger in the 20s and 30s, and that's because it started from 2 years old and 3 years old in terms of poor diet. We also say that baby fat, you get that, family was baby fat. Well, guess what? That's not a baby anymore, and that baby fat is real high BMI that's beginning to drain and cause major illness and body harm in that individual, young as they are.
That's so disappointing. Okay, so let's try to leave this on a happy note. Dr. Corey Hébert, we're going to end this with you. Last question before we have to wrap. We know type 2 diabetes is preventable. Is it reversible?
There's a study that came out about a year ago now, and if you get type 2 diabetes and you lose 10% of your body weight in the first 6 months of your diagnosis, your diabetes will be gone. That's how serious this is when we first make the diagnosis, that we have to jump on this immediately, because people have to wrap their minds around, look, I cannot eat this stuff anymore. Now, this is the key. People don't realize that if you eat a bowl of rice, that has as much sugar as 2 bowls of ice cream. Everybody that's watching this right now just dropped their remote control, because people don't realize that you will eat a bowl of rice for dinner, but you'd never eat 2 scoops of ice cream for dinner, but that's what you're doing. So it has to be about the concept of knowledge. We have to get out there, boots on the ground, and teach people. And that's what we do at BNC. We educate on all these things so that we can see our children do better and grow into healthy adults in the future, so that we can do things and positive things so that we can make our communities better.
Absolutely. Doctors, thank you so much for joining me. I, and I'm sure our viewers at home, enjoy your insight. Always a pleasure.